So, today we are going to talk about vagal indigestion, also known as Hofland syndrome. Historically, these are divided into type 1 through type 4, although clinically people often simplify them into proximal reticulo-omasal problems versus distal pyloric outflow problems. Type 1 vagal indigestion is failure of eructation. Basically, the cow cannot belch normally, so gas builds up in the rumen and causes free gas bloat. Treatment depends on severity. If it is mild, you may pass a stomach tube and relieve the gas. If the cow is severely distended and struggling to breathe, this becomes an emergency, and you may need trocarization or even emergency rumenotomy. You also have to correct the underlying cause, like esophageal obstruction or impaired motility. Type 2 is omasal transport failure, or proximal functional stenosis. In this type, ingesta does not move properly from the reticulum through the omasum. These cows often have chronic weight loss, decreased manure output, rumen distension, and sometimes that classic papal-shaped abdomen. Treatment is often supportive early on: fluids, electrolytes, rumen transfaunation or cathartics, calcium if indicated, exercise, and treating the underlying cause, like traumatic reticuloperitonitis or adhesions. More advanced cases may need surgery, but prognosis can be guarded. Type 3 is pyloric outflow obstruction, or distal functional stenosis. Here, the problem is farther down, near the abomasum or pylorus, so abomasal contents cannot empty normally. These cows may develop dehydration, electrolyte abnormalities, and abomasal reflux, so treatment focuses on correcting fluids and electrolytes and then addressing the obstruction surgically if possible. Type 4 is late pregnancy indigestion. This happens in heavily pregnant cows, where the gravid uterus interferes with normal forestomach and abomasal motility. Treatment is usually supportive, but improvement often depends on relieving the pregnancy-related pressure, either by calving or, in severe cases, intervention. So the key takeaway is, vagal indigestion is not one single disease. It is a syndrome of impaired forestomach or abomasal motility, and treatment depends on which outflow pathway is failing and whether the cause is functional, inflammatory, obstructive, or pregnancy-related.